Wuhan, ground zero for this mysterious virus, and it's also showing up in other cities.
It's contagion now.
It has confirmed that it can be transmitted between people, and in one case, one person.
World Health Organization
if they're coughing and a cough droplets get on surfaces, and you touch the surfaces of their face, then you can get it that way as well.
Has decided to suspend game play.
Contain an outbreak in a region or country have failed. The pandemic describes how widespread an illness is.
That COVID-19 can be characterized as a pandemic.
March 11th is a big day for Arkansas, as that was the first positive case that was recorded in Arkansas. And I think that was kind of one of those deals that we weren't sure at that point what it was going to entail or do.
Even when we knew it was a pandemic, you know, none of us have lived through a pandemic. And I don't think I'm sure I didn't fully appreciate the seriousness of that, what it would become. I think we were all still hopeful that that this would come and go.
I remember getting the call from a friend of mine who worked at the Department of Education, and he said, "Hey Jared, I think that we've got an issue. It's coming up. I think the governor's going to declare an emergency and we're going to vacate school." And I said, "That's not going to happen." And he said, yeah, I think it is.
I first received some information from my family in Spain. It's kind of when we first started to talk about what COVID-19 was, and it was something that was like an invisible threat that's how we talked about it. After that is when I started talking to family that lives in Mexico and then the United States, which is when in March we realized that it was something very serious and very real.
It was pretty scary, you know, the unknown, not knowing what was going to happen here or nationally or internationally. It was a scary time.
I mean, it was heavy, you know. So I look at things through a couple of different lenses. I'm a parent, first and foremost. I'm a lifelong resident of Springdale, and I'm an employee of this public school system. So I think through those three lenses, I mean, it was heavy.
When you consider how we were so significantly impacted by the virus, our Hispanic and our Marshallese communities, we went through some things that not many cities in Arkansas had to go through.
I did not know the impact, the devastation that it will leave us. Marshallese are very prone to chronic diseases. I was just so heartbroken. It was very, I think it was something that we had never experienced before, where immediately when the first death came into the media, that I believe it was a Marshallese guy who was really a young person in his early 40s. That was really heartbreaking. So it hit us right there. It hit me as a person, and also as a community leader, I was very, very concerned.
I think this pandemic has made very clear some of the disparities, some of the differences, some of the inequalities that we have, not only in the United States, but also in the whole world.
Literally every week, almost, we were hearing that there was somebody who passed away from our community due to COVID-19. Over 50% of our death cases in Northwest Arkansas were Marshallese. That, you know, it was just unspeakable. We were just, you know, we were broken, I think, and yet we were still resilient. We wanted to remain strong.
Recently, it's hard to talk to someone and not have the feedback of them knowing someone close to their family or someone in their close circle of friends that has passed because of COVID-19. So I think that even if it's one life that we can save, if that's something we can do, we have to do it.
The first thoughts that we were having were, what is this going to do with the population, the client base that we were already serving? What was going to happen to those that were in industries that were going to be so severely impacted by COVID-19?
So right away, the hardest things to worry about was to stay open or close. You know, so many of our customers are elderly, are the people that we were most worried about getting sick. And, you know, they eat at our restaurant every day. And we're such an important part of their life. You know, do we really want to close or stay open? And all at the same time, you know, my mom had been kind of getting sick too, so I ended up doing this a lot by myself when my mom had been my partner here running the restaurant. So here I am having to make all the decisions. And there I was just every day just reading and listening to news and consuming all the information I could. And, you know, waking up to it, going to bed to it, all of it just crashing down on you, trying to make the right decision.
Everybody was impacted by COVID-19. Springdale has been resilient over the years. We have been known as a blue-collar town with tremendous entrepreneurial spirit.
Our community as a whole really stepped up, and as the seriousness of this pandemic really hit home, I think our residents took it seriously, and I think we saw the community come together in ways that it only can during tough times like this.
Cohesiveness of people willing to help, willing to pour out, willing to join and lock arms to combat the needs in our community has been incredible.
I can remember early on, before we had any mask mandates, our city council was very forward thinking. We took a proposal to the city council to purchase 200,000 masks to give away to our residents, and that was unanimously approved, and over in just really a few hours, in 2 separate giveaways, those masks were gone.
We now have the Northwest Arkansas COVID Task Force. That was a coordinated effort between all the fire departments, police departments, hospitals, schools, and we all got together and started working towards a common goal.
Every city in America has those that fall on the line of whether they think we should be wearing masks, we should be distancing, whatever it may be. But I think Springdale, as a rule, has done a pretty good job. And that goes to the can-do spirit of our city.
This group of men and women that have collected in Springdale are the strongest people I know, not only mentally, spiritually, physically. They joined together, really locked arms and said, okay, we're going to get through this, but we're not going to do it by ourselves. Collaboration trumps isolation every time.
Within my particular field, it's been amazing to see other pharmacy owners come together, pharmacists and pharmacy technicians and staff members work together for the common good to provide, you know, in our industry, vaccine to our community.
They discovered the genetic material. They sequenced every gene in this thing in February of last year. Within a month, we had a vaccine. So between March, when we injected the first patient, and December, when they rolled this out, I mean, that's, you know, 9 months. I mean, that's a really quick period of time.
When you have a pandemic that touches everyone and impacts everyone, it has a tendency, even in the middle of all the loss, it has a tendency to bring us together and make us closer. And I know Springdale's tagline has been, we're making it happen, and I think that's exactly what we've done. We've made it happen. We found a solution, we found ways to move forward, and we've made it happen.
Remember how we all pulled together and worked together, and that's a great testament to our residents.
Let's stay the course. Let's wear our masks. Let's wash our hands. Let's socially distance. Let's get the vaccine when we finally become eligible to take our vaccine, and let's knock this out.
I think when you look back, we just need to make sure that we say thank you to teachers, that we say thank you to nurses, that we say thank you to our police officers and firefighters. We say thank you to our principals and our support services members, and the people who just made sure the city stayed open in a way that our children were safe and that businesses could still try to survive in this environment. Looking back, the last year of coronavirus, we stayed together. We made sure that Springdale knew that we care about Springdale.